Hello again, everybody, and welcome to this edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me again is Dr. Deanna Lassegard, an emergency medicine doctor at Monument Health. Back again. This is. I know Saturday Night Live has like their 5-time club for guests that host. So you're 2. So we're going to get there with you.
This is
all
number
right?
2, yeah.
Yes.
If there's any other wholesome activities you want me to,
we talked
make
last
people
time.
worried and self-conscious about from the safety perspective, I'm willing to come back and discuss those.
That's what's great. We talked fireworks with you last July, late June, early July. And all the dangers, of course, that come along with that. And the stories are, well, you don't, let me put it this way. You don't want to be in a story that you tell.
Yeah,
I think when it comes to that, right?
One of my examples.
Right, exactly.
Of what not to do, yeah.
So today we're gonna, with summer approaching, and we're getting ready finally to maybe see some, sunshine and warm weather and our lakes and things that we have around here and our pools and our water parks. We got to talk about swimming and swimming safety, right?
Yeah.
How long now? If you go back and listen to the Fireworks podcast, it gives a little detail about you. But just again, really quick, you're from here. I mean, you're born, raised, really.
Kind of. I
Local as could be.
graduated from Central High School. My dad was in the military, so we moved around a lot
course.
when I was little. But
Okay.
I've been here since middle school on. And I worked at Monument as both a paramedic and a nurse for quite a while before I went to medical school. And so now I'm back and got my dream job. I work as an ER doctor. I'm really passionate about injury prevention, especially in kids. And that's why I got tapped to do these chats with you, talk about how we can minimize having to come see me in the ER.
That's interesting that you have a job where you really want to discourage anybody from seeing you.
Yeah.
It's kind of what it comes down to.
The goal is not to meet me at work.
But, well, I'm glad we do, though, because I'm glad you're around, honestly, for these kind of injuries that can pop up, especially during the summertime when we finally do get to be outside and, we all get excited because we have such a short window of being able to do anything with warm weather around here that we kind of lose our mind a little bit in some instances. And I think swimming, something we all like to do. Most people like to do. We have great opportunities to do it here.
Oh, we do. We're so blessed with our amazing lakes.
Exactly.
And we got streams and rivers. It's such an outdoor paradise here.
Yeah, we have so many wonderful waterways. But that leads to issues that people have to come and see you about. And, the obvious one is, we'll just start with drowning, which is the biggest concern people have, especially with kids.
Absolutely. And it's a valid concern. It's the #1 cause of death for children ages 1 to 4. And so it is a big deal. Drowning at home and drowning outside of the home for children is very scary and very realistic. It is the second leading cause of death for children under 14 as well. So it's not just the little ones, who can't swim and who can barely walk. It's all the way up to 14 years old that it's that big of a problem that it's the second leading cause of death.
And when it happens, or when you're out on the lake and you're swimming and you're just enjoying a summer day, everybody starts to I don't know, you lose track of a kid, say maybe, or even an adult. It can happen to too, of course. People will think, well, if that ever starts to happen, I'll know, right? Mm-hmm. I'll hear them yelling, "I'm drowning!" I'll see flailing, and I'll see there'll be obvious signs, but what we've learned, I think, over the years, the general public, none of that's true.
That's a very common misconception. Drowning is actually a silent activity. By nature, you're under the water. They can't speak, they can't get air in their lungs, and so drowning is a silent activity. Often there is no splashing because they're under the water, and it happens very quickly. In less than a minute, someone can drown and die.
I can't believe it's that fast.
It is.
Without getting too graphic into it, what happens when you drown?
It's technically an asphyxiation, meaning you're not getting oxygen. So you can't get oxygen into your lungs, and then cells start to die because they require that oxygen for metabolism. But there's also another problem with drowning. Getting that liquid into your lungs washes out the surfactant that keeps your lungs open and oxygenating, and so it very much damages your lungs after the fact. So some people who are rescued from the water, who drowned, and then are pulled from the water in enough time to get their heart beating again, they often will still perish because of the damage to the lung tissue.
So it's just bad all the way around.
It is. You don't want water in your lungs. It's not meant to be there.
Right.
Yeah.
So if someone witnesses a potential drowning, let's say they do recognize the signs, what are like the first crucial steps that you need to take in that situation?
The first crucial steps are making sure that you also don't become a victim. So if you do not know how to swim, you should not be providing water rescue. Ideally, there would be some sort of flotation device that could be given to them or things like that. But it is really important to remember that if you're not trained to do those types of rescue things, you can easily become the second patient. And so a person who is scared and drowning often does not follow directions well, and they will often take down a person who is trying to rescue them. So it really is a job for a pro, for someone who knows what they're doing, or if it's a child, an adult who can go and get them. It's also really important that we activate emergency services early. If there's a drowning or a potential drowning, I don't know where my kid went, we're near a body of water, activating those services very quickly is important. So calling 911, getting the rescue people there. So
let's say you're in a lake, though. Let's say you're at Angostura or any of the big ones that are up in the hills. What is it like for emergency services up there? How quickly can they be there?
Depending where you're at, it can be quite a while.
Right.
Some of the closer lakes to town have closer access to EMS services. If you're way out there, like you said, Angostura, Sheps Canyon, something like that, that is a long time for EMS to get there. So that's where prevention really becomes the key, is making sure that this does not happen altogether. Just avoiding the entire scenario by utilizing safe watching of children, wearing life vests, and utilizing a lot of the different safety things that we're going to talk about today to help prevent this from happening in the first place. Because when it does happen, it's so catastrophic when it does happen that often, even with quick rescue and even with getting to emergency services quickly, it still has a very poor outcome. So what we really focus on is prevention as a whole. Make sure that we don't have these kinds of drowning cases.
Well, let's talk about that then. Let's talk about what, it just seems so obvious. It seems like we have done in this information age that we have right now, that we have done a much better job of telling people, look, if you are on a body of water, you need to have something that keeps your head above that water, which is a flotation device, which is a vest, which is a
but they're not fun.
Right.
Life vests are not
it.
fun.
Yeah.
They're not comfortable. They interfere with your tan. It's just altogether not a fun thing. Like, you see pictures of people at a lake having fun. No one's wearing a life vest in those types of things. And that's what's really dangerous about the scenario, is that people are often fooled into a sense of safety because they can swim. They know how to swim. And they're like, I don't need to wear a life vest on the water. I can swim. I'm an adult or I'm a teenager. And oftentimes when people drown who know how to swim, it's because of an incapacitating circumstance. So they fall, or they hurt themselves and then they can't swim well, or they're, in a catastrophic situation, hit by a boat or hit by a jet ski.
You used hit by a boat, which really
and
drove it home for me.
You can swim, but if you're injured, you can't swim. And accidents happen. And so having a life vest on when you're on a body of water at all times is by far the best and safest thing you can do to prevent drowning.
Are there anything outside of life vests, if maybe somebody doesn't want to wear those? Are there other types of water safety clothing that people can wear, or is the vest just still? The
vest is the best, and you want something that is certified by the safety people. U.S. Coast Guard approved flotation device.
Oh, of course.
Yes, there are lots of other fun flotation devices. Inflatable unicorns that you can ride on the lake. That is not a Coast Guard approved flotation device. That is going to save you. Those are super fun. I'm not saying we shouldn't use those, but you should not look at that as your backup plan, as your safety plan, because that does not offer you any safety. That's just something fun to play with.
Well, and it has to be, it can't be something that you have to cling to if something bad happens. Like you said, if there's an accident.
It should cling to you.
Right,
you should not have to cling to it. It should be a passive, it does the work for you. You don't have to work do the work device. And so that's what's really important about a certified life vest, because they're meant for both conscious and unconscious victims, keeping that head above water. That's exactly how they're designed. Your unicorn flotation device and your floating bed are not designed for anything more than fun and pleasure. They're not designed to keep your head above the water if you're unconscious, whereas that's what a flotation device really needs to do, is keep the parts that breathe air in the air and the parts that were fine under the water under the water.
So we hear a lot about pool safety for kids too. If you own a pool, if you own a hot tub, even if you have the wading pools, things like that, all of that, you've heard probably your whole life, you can drown in 2 inches of water. And I suppose that's very true, isn't it?
It is.
So anytime you have a kid around water, you should have some sort of safety device there, right?
And you should have more than one safety device. It's really about layers of protection. Each individual safety device on its own is not 100% perfect. It's all about layers of protection when it comes to drowning prevention in young children. And what I mean by layers of protection is I mean that there's an adult assigned to every child to make sure that their head is above water, and that adult should not be playing cards and drinking alcohol and having conversations with other adults. They really need to be an adult who is watching that child who's in the water. And every child should learn how to swim. That's one of the layers of protection. Get your kids into swim lessons. The Y offers them, the city offers them. There are lots of great ways to teach your children how to self-rescue, and that's super important. It is a lifelong skill, learning how to swim. And then there's also, wearing safety devices. There's having a life vest on, things like that. There's also, if you own a pool or have access to a body of water, there are fences that have alarms. Those are all parts of the layers of safety. But here in South Dakota, we really don't have a lot of, year-round pools. So
no, that's
true. We
true.
aren't as good about knowing about these layers of safety.
Because of that, probably.
Yeah, as the people who live in Florida and who live in California who deal with swimming safety year-round. So they're constantly bombarded with it. We think about it at the end of May, June and July, and part of August.
Right.
And that's pretty much it. And that's where a lot of the knowledge falls through the gaps, is we just only think of it during the summer, and we don't have that constant education coming from our pediatricians and coming from our home safety experts, like people who have pools in their backyards do.
Well, that's what we're doing right now. We're making these people aware. When it comes to like adult swimmers, are there things that outside of the safety devices, are there things that adult swimmers should be aware of when they're getting out and going and getting into the pools and the lakes and the rivers and everything? Like conditions, medical conditions, things like that.
There are a lot more risks, of course, associated whenever you're drinking alcohol.
Yeah, there we go.
And most people who are out on the boat in the summer enjoying a nice day are also enjoying a nice cold beverage. And our ability to assess risk and respond to dangerous situations is inhibited dramatically by alcohol. And so a lot of drownings in the older population are because of alcohol consumption. A lot of them are also because of power sports. Either they're on a boat that crashes, or they're hit by a jet ski while they're fishing, or things like that. And so when you get to like the 18 plus age range, what the drowning is caused by is a very different picture than what it is in small children. It's often people who are taking risks, who are doing cool, fun things, like jumping off of cliffs and riding jet skis. That's kind of more what we see when it comes to people over the age of 18 when they drowned. Okay.
While we were have been talking about drowning, I remember as a kid thinking, you know what? The longer I can hold my breath underwater, the better my prowess will be when it comes to swimming or just being out in the water at all. Is that dangerous? Is there any fact to that at all? When you're just goofing around and think, I can go for a minute and a half.
It's wonderful to have strong, healthy lungs
Sure.
and be able to hold your breath. Those people who are young and healthy and have good pulmonary reserve, of course, will do better if they get into a drowning scenario. But I mean, that's by like 30 seconds.
Oh, yeah, that's
beyond
true.
the average person. So it is not as protective as one would think. And while we're talking about things that are not as protective as one would think, the ability to swim really is not as protective as one would think. Oftentimes when people drown, It's not just because they were in water. How did they end up in the water? They ended up in the water because they crashed their jet ski or because they hit rocks when they jumped into the water. These are injured people. So your ability to swim kind of goes out the window. Everyone should learn to swim. It is a wonderful protective thing, but it should not be so protective in your mind that you're like, I can swim. I don't need to wear a life vest.
Right. Because
your ability to swim depends on your ability to be well at that moment, and you may not be. So.
Yeah, I don't even honestly think I've ever thought about that. Because you don't think, well, I'm going to get hit by a boat today, or I'm going to, you know what I mean? That's
where
the
I
reason.
come in.
Right.
Is telling people things that they're going to start to worry about at night that they did not worry about before.
I wasn't getting enough sleep as it is, doctor, so this is perfect. No, that's...
it is a special skill that I have, is to worry about things that most people don't worry about, because most people don't have to worry about this kind of stuff. But as an ER doctor, I see all the bad things that happen to people. And so I have a very different perspective on injury prevention and worrying about things that people think don't need to be worried about. It's great that most people don't have to worry about this, but that's where I have kind of this special niche, is that I see all the bad stuff.
And we shouldn't.
So I can educate about how to keep yourself out of the emergency department.
And again, no one should lose sleep over this, but once you're at the lake this summer, you should be like, oh, I heard that podcast with Dr. Lassegard. And you know what I shouldn't do? Have this 7th beer and then try to jump off this cliff, right? I mean, that's what you're hoping to put in people's minds.
Mm-hmm. I'm not saying you shouldn't do it.
Right.
Absolutely. These are wonderful, wholesome activities.
Yes, of
Go
course.
to the lake with your kids. It's wonderful. But do it safely.
Mm-hmm.
And there are a few ways to do it safely, and that's by teaching your kids to swim, making sure that you have appropriately fitting life vests that are Coast Guard approved for every family member, and making sure that the way we find out that they're appropriate fitting is by the weight. And so when you open up your life vest, on the back pocket, usually on the inside, it will say what it is Coast Guard approved weight for. And so as your children grow each year, they're probably going to need to move up in sizes. And the reason that they have that weight on there is because that is enough flotation to keep a person of that size head up. Again, it's really important that they're Coast Guard approved, because those are the ones that are fitted for a body of that size, of that weight, to keep the head above water.
Simple.
Yes.
It really is.
It is, but you don't think about it until you're at the lake and realize that your kid's life vest is 20 pounds too small, for what they've grown this year. So it is important to, as we're getting ready for summer season, while we're, packing up all of our fun things and buying sunscreen, make sure that we have the right life vests for our kids as they grow.
Are there resources online that you get frustrated with that just have the dumbest advice when it comes to stuff like this?
When it comes to water safety, it's all actually pretty good. The resources that are online are good. They tell you the layers of safety has become a really important kind of catchphrase when it comes to water safety. Not just having one thing that you do, not just teaching your kid to swim, but having those multiple layers of safety. And so most of the stuff that you'll find online when it comes to preventing drowning is really good information. Of course, whenever you start digging into the internet about medical treatment, then there's always a little bit of, you kind of have to look at your source, make sure it's a medical source. There were stories a few years ago that I'm sure you probably recall about a situation called dry drowning.
That's where I was leading this.
Oh,
yes.
yeah. And those years when that came out, boy, were we busy in the emergency department with people who would come in, with a kid who...
So you thought you had people come in with that?
We did. We had people come in who had seen those news stories about dry drowning and were very concerned about their children's welfare. So kids will get into water and kids will get over their head, at periods of time. And then they self-rescue or somebody grabs them because they're doing good water safety. And those kids would get brought to the ER to be evaluated because they had an episode where they had drowned, where they were struggling in the water and they were worried about dry drowning. And the story that kind of came out about this dry drowning was that it was a vocal cord spasm and it closed off your vocal cords. So you never got water into your lungs, but you still suffocated and died. And that's just not really realistic. On autopsies that we've done with drowning victims, we do not see a phenomenon called dry drowning. There's just drowning. You either drowned or you don't. and you either die or you don't from your drowning.
Right.
And so someone who is trapped in the water and who is struggling and who is getting water into their lungs and water into their airway, they have drowned. And they may die from that or they may not die from that. But there's not varying degrees like dry or wet or partial. It's just drowning.
So now that you're talking about this, I don't think I asked you the question of really defining what drowning is. Because I've heard you say that people have gotten water into their lungs and drown, and whether they survive or not. I'm trying to figure out how to ask this question.
And that we're kind of getting into the weeds a
is
little
that,
bit
is that
on
what
that
that
one.
is?
Yeah,
Okay,
because
then
that's
I'll leave
kind
that
of a
alone.
medical diagnosis.
Okay, got it.
But what the moral of the story is that I want to impart to parents and that I want to impart to everyone is that they don't have to worry about this thing called dry drowning.
Good.
This is not something that, is going to sneak up on their child 2-3 days later after they were in the water. If your child or an adult or anyone gets involved in a water situation where they are drowning and they are getting water into their lungs and they get rescued from the water, if they have any degree of symptomology, if they are coughing, short of breath, anything like that, they need to be seen by a medical professional. Anybody who's been submerged in water and has symptoms afterwards needs to be evaluated. If your kid swims a little too far to the deep end and swallows a couple gulps of water and is A-okay and has no trouble breathing and is not coughing and everything's okay, those kids are going to be fine. They're not going to die 2 days from now from some phenomenon that was publicized a few years ago called dry drowning. Our literature does not show that that's a thing.
Oh, I'm so glad to hear that, because it was such a big deal. And I remember everybody just freaking out over that.
And parents appropriately,
of course,
worried about that.
Right.
They brought their kids to the ER. But what we have found is that's not a thing. If your child has symptoms after drowning, they absolutely need to be evaluated.
Okay.
And whenever you have a concern, moms and dads, they know when something's wrong.
Yeah.
And if your gut tells you that your kid needs to be looked at, your kid needs to be looked at. That's always kind of the overarching, because moms and dads are right. They just know. They have that gut instinct when something's not right with their kids.
We do, for sure.
Oh, yeah.
All right. Well, this has been great again, Doctor. Thank you for coming in and talking about this and setting some things straight, too. I know we're going to talk with you again here in a bit, because we've got some more safety things we want to talk about for this summer for sure. So thank you again, Dr. Deanna Lassegard from Monument Health Emergency Medicine. Thank you for coming in. I appreciate it.
Thank you very much for having me. I'm very passionate about this topic.
Yes, I can tell. I love it.